Hello, everyone. Welcome to webinar number 4. This webinar is brought to you by Forum Health in partnership with the Longevity Lab, where we are trying to make credible health advice accessible, affordable, and actionable for all of you. Today, as always, we have Jocelyn Segal and Dr. Shilpa Saxena, who will be leading the topic for today. And over to you, Jocelyn and Shilpa.
Welcome back, everyone. We are excited to continue our journey on menopause and women's health, and we thank you for sharing our webinar again with all the ladies in your life. So our last webinar session, we discussed about bioidentical hormone replacement therapy, and Dr. Saxena gave evidence to show the safety and efficacy of it. Today, we're going to focus on sexual health, intimacy, and how to remove barriers to intimacy to gain confidence and self-care. So we understand this is a sensitive subject, but we want to assure you to feel safe and supportive. So our first question, Dr. Saxena, why don't we start a conversation about the physical challenges of menopause, specifically vaginal dryness and discomfort? What causes this specific change, and how can we best treat it? Oh, I think you're on mute.
Thanks for that, Jocelyn.
Welcome.
So yes, I want to just echo what Jocelyn said, that this is a subject that can take a little bit of warming up to. And we're going to, in the examination room, a lot of times providers will start with the objective physical part, because that's what, feels distanced enough for women to start talking about. And then as we're talking about the medical stuff, some of the psychosocial, emotional stuff will get layered in, and we're going to use the same format for this webinar. So we're going to kind of stick to medical in the beginning, but hopefully we will all get more and more comfortable talking about some of the other aspects outside of just vaginal dryness. But we're going to start with that very important subject, which is a common symptom of perimenopause and menopause. So vaginal dryness, which is sometimes called vaginal atrophy if it's happening kind of on the inner canal, or it might be called vulvar dryness or atrophy if it's happening on the outside of that perineal area. So this dryness is often because the ovaries are making less and less estrogen. So as the levels decline during perimenopause and menopause, that estrogen, remember, is like Barbara Streisand in one of our previous webinars, and Barbara likes to make things grow. And one of the things she likes to grow is kind of a thick, mucus-producing, elastic vaginal wall. And so because there's less and less Barbara around, we'll see thinning. You'll also see this shifting of color, which if you're looking, it'll go from being kind of a more rosy pink to a pale pink. So it's thinning, it's a loss of kind of vascular, meaning blood supply. And then all that also reduces elasticity of those walls. And when we have less rebound or elasticity of the vaginal walls, because they're just thin and dry, we talked about how things can start falling into that vaginal vault. So if it's the bladder that's kind of pushing in on the wall, we call that a bladder prolapse. That can affect your sexual health. Or it could be the rectal vault that pushes in. That would be called a rectal prolapse or rectocele. And in order to improve that, we can always start first. If it's just straight dryness, you can use non-hormonal moisturizers. There's definitely lots of lubricants that are water-based that we can use for intimacy. Some women will use more natural things like olive oil, coconut oil, because those can be nourishing, not just lubricating. And then we can step it up another notch, which would be to repair and rejuvenate the vaginal skin. And that means putting in local estrogen. And most of the time we're using it in the form of a cream. Estriol is our favorite in functional medicine. In conventional medicine, people will commonly use estradiol. Estriol we get from a compounding pharmacy, and it is the safe little sister of Barbara. And so if there's any risks or concerns women have about estradiol, which is what we usually think of when we think of estrogen, estriol is super safe. I mean, we use that for women who've had a previous history of a estrogen receptor positive breast cancer because there's such trauma behind estrogen for some women. So it can come in creams, rings, tablets. It's very effective and safe for almost all women because it doesn't actually cross in significant amount the lining of the vagina. So it stays in the vaginal canal, helping the skin locally. And so it's addressing the root cause. It makes the vaginal skin more young. It helps it to secrete mucus, which of course is our natural lubricant that we would have available. So that's kind of like, we can always ask more questions about this in the chat, but let's start there when we say vaginal dryness and discomfort.
Okay. And we know with the thinning of the vaginal wall, right? So painful intercourse does occur. Are there any other hormonal options that we have or any other therapies that could be effective?
Yeah, great question. So thanks for bringing that up. So there's the dryness. I mean, dryness in and of itself without intercourse is annoying. I mean, there are women who just for the sake of the dryness itself will put themselves on a cream, a moisturizer. But when it comes to dryness plus vaginal intercourse, that can lead to pain. The medical term for that is called dyspareunia. You don't need to know it, but in case you read it, that's what it means. It's painful intercourse, often caused by this dry, thin tissue. So in addition to the vaginal estrogen creams, you can also use DHEA. Now, this is technically a hormone in the body, but interestingly, in the marketplace, it's used as a supplement many times. Compounding pharmacies will make DHEA suppositories, and it will turn into estrogen in the vaginal vault. It's a bit safer for women who are really, again, trying to avoid all kinds of estrogen for whatever reason. DHEA can be taken as an oral supplement, but when you take it orally, it's going to help. It's the Mr. Rogers hormone. It's the calm male energy. So if you take it by mouth, you get, improvement in anxiousness or tension. If you take it vaginally, it'll convert over. Mr. Rogers makes Barbra Streisand, is the father of Barbara, makes Barbara vaginally, and that can help restore tissue health. You can also do pelvic floor therapy. So just like you can do physical therapy for muscles in your biceps or your legs, you've got muscles down in your perineum. So your perineum is kind of the space between your rectum or anus and your vagina. That little zone is called your perineum. And there's a ton of muscles and ligaments and things that are in that space, including, 3 holes. You've got your pee hole, you've got your vaginal hole, and you've got your poop hole, if you will. And so those 3 holes are tubes, if you think about it, coming back into that perineum. And as we said, if the vaginal wall is thin, the bladder tube can droop down or the rectal tube can push up, and pelvic floor therapy helps put things back in their places, because you can just imagine if things are shifted around because of loosey-goosey vaginal tissue, it'll hurt when you have sex. The other thing is women who have not, and Jocelyn, I'd love to hear your take on this, women who have had vaginal dryness and just pushed through it, for lack of a better expression. And then what they do is it's painful. So what do? They clench. They start it's like this anticipatory clench. And so those muscles down in the perineum will get tight, and it's almost like a loop, like, sex, tight. And then that tightening can make it very painful at the entrance of the vagina, which is called introitus. Commonly where it is. And what pelvic floor therapy can do is retrain the muscles and kind of the orchestra of that place to kind of sound harmonious versus like a elementary school orchestra, which is okay, but wouldn't call it harmonious all the time.
I think what's interesting to note is that pelvic floor therapy was typically ordered for the purpose of urinary incontinence. And so it may not be well known for some of your providers to order that to help improve the vaginal health. So sometimes it requires a conversation with your provider to explain to them, what you're feeling and that you have heard that pelvic floor therapy could be effective. One thing I'd like to mention, though, is that not all physical therapists are trained in pelvic floor therapy. So it may take a couple phone calls to different physical therapists in your area to find out who is trained, but it is very beneficial.
And if we're just on that subject, the word, and maybe we can type it into the chat so you have it, but there's the term, the medical term of this tightening is vaginismus. And it's kind of, it's this anxiety or fear related to the anticipated pain of intercourse. And it can be quite severe that like women can't use tampons or even do like pelvic exams because it just clenches so tightly. So you could use that word with your provider if you wanted to be more specific. Now, it's also important, Jocelyn, that you brought up that a lot of times all this shifting around of the organs and the tubes down in that area can create incontinence issues. And let me tell you, most women don't feel sexy if they're feeling like they may be incontinent during intercourse. So it's an added perk to be able to address the tissue, get the tubes to go where they're supposed to be, so that you could maybe even reduce your incontinence issues. So Jocelyn, I think you and I commonly will recommend a vaginal estrogen for women who either have incontinence or recurrent or repeat urinary tract infection, because they're very connected.
I'm making sure I'm spelling everything correctly here. I'm not typing too fast. Okay, there we go.
Thanks.
Okay, very good. Let's talk about libido, because we know during it starts typically in perimenopause and menopause, how our libido is impacted. Maybe you could explain how that happens and why it happens, and how can we improve sexual desire?
Great. So we're going to move out of the realm of below the belt sexual issues, right below the belt. And my joke, and I'm generalizing here, but a lot of libido for women is above the neck, and it can absolutely be below the belt. For men, most of their libido issues are below the belt, right? Meaning like they just need some testosterone. So women, I used to think that a lot of it was above the neck, meaning, okay, we just need to have a better relationship with our partner. We need to feel good about our self-confidence, our body image. And then if that's the case, usually libido is there. But you can have all those things. You can have a wonderful partner. You can think you're, just hottie hots and have great confidence and still have very little libido. And that's because objectively, medically, you may have low testosterone. Okay. So libido for women is complex. We've got multiple knobs that we have to turn to get our libido on. Men, there's generally one, it's testosterone. And for us, if you feel like, man, I really feel good about myself, I don't know why, and I really love my partner, why am I not interested? I would have a total testosterone and possibly a free testosterone level checked. And when you look at the reference range, we've talked about this reference range, which you'll see on your lab slip, people think that if they're in that range, I've got an A, I'm good. That can't be the problem. And that can't be farther from the truth. When you are on that reference range, it's like, think of yourself in a classroom, and it's in that reference range is everybody who didn't fail. Okay, so that means the A students, the B students, C and D minus students are in that reference range. So if you're in the bottom half of the testosterone range and you're having low libido, you might be a C or a D student as it relates to your function. There are some women who are like in the bottom half and they got plenty of libido. Okay, great. But if you have low libido and you're not in the top half or the top quarter, it could be that you could boost up your grade, if you will, by taking testosterone, get to the upper quartile, and in functional medicine will often go beyond that quartile, beyond the reference range. So if the reference range many times ends at 45, it's not uncommon for women to get to 50 to 100 on their testosterone levels to feel the kind of libido or desire that they had in their 20s and 30s. Okay. We are not trying to make you a pubescent teenager with your testosterone levels. I don't know about anybody who wants to be 16 again, but I would tell you, most of us may desire what our libido was in our 20s and maybe early 30s before a lot of life happened. So that's what I would say. We'd focus on testosterone as the physical root cause, but let's not forget body image, relationship, and confidence.
I think that's important too. And having that open communication, which we're going to talk more about that, and how you can improve that with your partner. As far as we understand that there are some emotional barriers to intimacy during menopause, and how can we address them?
Yeah. So I think it's important, and we're seeing this in society, that women are redefining themselves. So if you are perimenopausal and menopausal right now, you likely were indoctrinated in a certain view of yourself. If you're the average woman, about what your role was, there's just a lot of things that you kind of accepted without even realizing they were potentially, I don't know what the word is, not unfair, but not in your favor. Okay, so there's we could just start with body image. You can see that there is a whole shift happening about women not dealing with objectification the way that we probably were very used to as teenagers and people in our 20s. So I would tell you personally, I'm learning a lot from my two 22 and 24-year-old daughters. They are teaching me so much about self-confidence and self-image, because it's like I have these tropes that were kind of ingrained in me when I was younger. So in terms of feeling confident and feeling like you look good, we really have to examine what are the things that you've said to yourself about your body image. What have you said to yourself about, your value in the world, whether it's as a woman, as a wife, as a sexual partner, as a mother, because all those things, if they're not optimized, could absolutely affect your total confidence and your ability to then connect in one of the most vulnerable things you can do, which is be intimate with a partner. So if you are feeling disconnected, if you are having body image concerns, then consider seeking counseling, whether it's couples counseling or therapy for yourself, and get guidance. I think also if it's just self-worth, there may be a need to really work on some mind-body medicine to kind of start filtering out the negative noise that can creep in. And then we want to put in things that help us increase our sense of value in and of ourselves. Because many women, we create our value based on how well we do as a mother, how well we do as a worker, how well we do as a wife or a daughter. I don't know if this is resonating with people, but I mean, we're so busy doing our checklist of how we need to be perfect in all these other roles that we forget about ourselves. And then we're expected, if we haven't gotten to the place of value and confidence, to all of a sudden feel completely vulnerable, get naked, and go be intimate with somebody that you may feel disconnected to. So,
and there's also that non-sexual, right? The non-sexual method of communication too.
Absolutely. I think that intimacy is a spectrum, and we have to understand that it's not just nothing and vaginal intercourse that we're talking about. Things like cuddling or spending time together, just gentle forms of touch that make us feel connected are things we may need to look at. Could be that the reason why you're not interested in full intimacy is because there's nothing in between on a day-to-day basis that helps you feel connected to want to then go to the next level of intimacy with your partner.
I'm glad you mentioned that, because my next question is, how can partners support women during this phase to maintain that intimacy and connection?
Whew.
I know that's a tough one.
Big question. So I think that, women are more and more speaking up about their needs. And so as they're defining what's important to them, their values, they're defining their duties. Like, what is my duty? To what extent am I doing this because I want to do it because I think it's my duty versus I'm doing it because somebody else has said it's my duty? And then boundaries. I think that's another word that is now very common amongst women. So values, duties, and boundaries. I think having open, empathetic communication with your partner about what's important to you, what's your love language, what do you think duties are for each person in the relationship for intimacy and connection, and what are the boundaries? And hopefully that partner is able to listen without judgment and that they're curious. I gotta cite Ted Lasso here. If you haven't seen Ted Lasso, one of my favorite TV shows, he says, be curious, not judgmental. And that's what we need to be about this subject matter with our partners. Mm-hmm. It also helps to educate your partner, if they're not familiar with menopause, on what's happening. I mean, they're probably experiencing what's happening and may not know, like, what's going on? Why is she not sleeping? Why is she so irritable, or what's going on? So, just like I've had to have conversations with my husband, who does not have a sister, and didn't have a mother who kind of openly talked about her female issues. So he's kind of coming in blind when I'm going through these things. So it helps for him to have me educate, kind of like we did when we were having our periods or when we were pregnant. Like, you have to educate your partners. They're not psychic about what we're going through. And perhaps being creative around new forms of intimacy, like massage, like physical touch can, and it doesn't have to be sexual, it can be still very intimate. Also spending quality time, there's that Love Languages book where people talk about, like, is it affirmations, or is it quality time? Is it thoughtful gifts? Figure out what are your love languages and start actively communicating about them. Because one thing that I've learned is that many women, including myself, have this thing like, well, listen, we've been married for 25 years. You should know me by now. Do I have to actually ask for it? Do I have to ask for what I need as a love language? Yes, we do. We do. Because they're just not psychic. And in their defense, neither are we. They probably need to communicate what they need as well, too. I mean, it sounds so basic, but I think many of us just hope that, he, like Fabio, will come in on a horse with his hair blowing and do the most chivalrous romantic thing. And I don't know if men know what what is your definition of the Fabio on a horse, because it may not be Fabio on a horse for you. I'm dating myself, aren't I, Jocelyn? You're like,
oh, I read those romance novels, so I'm very familiar with the covers.
I never read them, but it was definitely an iconic character back in the day.
He was. So you did mention about body image, right? And how that can create emotional barriers to intimacy. And actually here on the WhatsApp, we've seen the participants, share their experiences of weight gain, especially in the belly. And we know, very understandable, how that can affect your body image. So how does our body image shift during menopause, and how can we regain confidence?
Yeah, so the body does change during perimenopause and menopause, right? So hormonal changes affect our metabolism, and metabolism then affects very commonly the shape of our body. And because many times we're in this sandwich generation, like taking care of our adulting kids, taking care of our parents that might be regressing in terms of their ability to take care of themselves. So we've got like two sets of caregiver things that will create cortisol, which in combination with low testosterone and low estrogen can really start to increase your risks for belly fat. So you get this little pooch, as they say, and, you know, especially if you've never had one, that's a shocker. And I do think that if society, especially the way we were raised, continues to make this ideal female image look like there should be a flat tummy and or, you know, a six-pack set of abs, that could really get into our head about I'm not attractive, I'm not worthy. And so I think we just need to revisit that and understand that, okay, what is it that we want for ourselves? Again, what is our value? Like, is my value that I want to have a six-pack set of abs? Okay, well, listen, you can work with personal trainers, nutritionists, functional medicine providers, and you can optimize a lot of things to optimize your body. If that is your value, there may be somebody who's like, no, my value is that this is who I am as I age. You know, I don't need to stop the wrinkles. I don't need to stop, you know, the belly fat beyond what the health risk it may create. Like, I'm okay with this. Great. Then have a conversation with your partner, because there could be a chance that your partner doesn't care about the pooch as much as you think he or she may care about the pooch. Wrinkles, same thing. I mean, I think a lot of times women self-impose a lot of extra demand on their appearance beyond what our partners may actually communicate as a need. Hair thinning is the other thing, right, Jocelyn? That's when progesterone levels go down. Hair thinning is common, and that's very connected to women's sense of confidence and beauty. So there are medical things that can be done. And I think that has to always be counterbalanced. I mean, I'll say personally, I'm a South Asian, and my genetics, like I mirror my mother's body type. And, you know, like it's almost impossible for me not to have a little pooch. Okay. I feel like I could eat perfect, meaning as perfectly as I can without going crazy. Because I'm not a believer in perfection. I'm a believer in, you know, do your best, trust the rest. So if I did my best nutrition and exercise and I slept well and I tried to reduce my stress, I still think I'm going to have a little bit of a pooch. So then that's where it comes to me like, all right, so are you going to keep hitting your head against the wall over this little pooch? And, you know, I'm still working out. And if I kind of have shifted my goal to be more about, am I strong? Am I vibrant? Am I like confident with a little pooch? It just happens to be there's a little pooch attached to my confidence and my sense of self-worth. Because the fact that I'm exercising and eating right, I've shifted that to be the reason I'm confident, not because I have a pooch or don't have a pooch. That's between, you know, each woman and herself to decide, you know, what is the thing that I want to be strong in? Like, how am I going to take care of myself? How am I going to dress in a way that makes me feel good and empowered? And maybe women, we do well being around other women that lift us up. And sometimes it takes another woman and not your male or female partner to tell you, like, you're gorgeous. Stop it. Like, sometimes we won't believe it from our partner, that it will take a group of our girlfriends or friends to tell us how we can reframe our relationship with our body, because they might say, we're going through the same thing. And then you don't feel like such a, you know, dropout or something like that, right? A lot of stuff, a lot of crazy can happen up in this head if left unchecked, right? So we do well as women. It's our strength to work like in circle, to work with other women, to work with others. It doesn't even have to be other women. It can be work with others. I mean, that's how we really forward ourselves, I think.
Yeah. And I think when we talked about bioidentical hormone replacement therapy at our last webinar, we did indicate how, when you have all three hormones on board, you can you can lose weight with it. It changes your fat distribution. And this is also from personal experience. So for many of us who noticed that 10-pound weight gain in the belly, and despite all efforts, it hasn't improved, you'll find that you start the three hormones together, and all of a sudden, oh, well, it's not so loose, it's a little bit firm, and now it's kind of shifted a little bit. So your clothes may be fitting different. You may not actually, or you may not have like significant weight loss on the scale, but you're feeling it. And you could see, wow, I can feel my pelvic bone that I haven't felt in 10 years. That was very interesting that I found. And I just want to mention too about like the hair loss. I think that for every woman, everyone struggles with different symptoms of menopause. And I think for me, hair loss was almost catastrophic. And to me, that affected my self-image than anything else. And so, always focus on what is the most important symptom that you want to improve on, so that you can, help your body and your image, come back into place to where you need to be. Don't ignore those symptoms. They can be fixed. And hopefully you're going to have a provider that's going to listen to you and help you with that. Dr. Saxena, you did mention, go ahead.
I was going to say, I wanted to piggyback on what you were saying. One of the things that I've noted from 20 plus years of practicing this form of medicine is that, I used to be someone who long ago was like a minimalist, like lifestyle only, food only, exercise only, like avoid medications. I'd opened up to the value of supplements because I'd seen so many people get better from supplements, but I was kind of like in general a prescription avoider. And what I noticed is that there are some people that until they get their hormones optimized, other things just don't work. Like, for example, women are starting to use GLP-1s, which are things like Ozempic and Wegovy, semaglutide, tirzepatide, those kinds of things for weight loss. And some women are losing weight, but they're losing their muscle, which is the most dangerous way to use a GLP-1, in my opinion, because you are setting yourself up for rapid weight regain, and muscle is equal to healthy long life. So as muscle goes down, healthy long life goes down. So one of the things that we can do that is super powerful is coupling hormone replacement therapy, which now my new mindset is like, okay, I'm putting back into the body what was originally there, and I'm going to use the lowest effective dose to get to the goal. So the lowest effective dose to get my vaginal vault to feel comfortable and functioning. The lowest effective dose for my testosterone to allow me to make muscle when I'm working out. Because if I'm taking a GLP-1 for weight loss to make my body look better so I feel more vivacious, and then I'm losing muscle, man, it's going to be a slap in my face 6 months later when I regain the weight, and then I'm going to feel bad about myself or stupid or brr, brr, brr. So don't forget that hormones are sometimes just the foundational need for other things to work better.
Good. Other than bioidentical hormone, are there any other specific lifestyle changes in order to improve their sexual health?
I would have to vote that exercise is, out of the four, well, I would say exercise is the one that I would pick over nutrition. Now, let me tell you, I'm not telling you to eat a crappy diet. Obviously, eat a balanced diet, get healthy fats in, like omegas. One of the things that is important to note is that if you're taking a medication to lower cholesterol, you can actually lower your cholesterol too low, and you cannot make hormones like testosterone. And so make sure you don't over-treat your cholesterol issue. Make sure you take good fats in, like salmon, omega-3s, because those are healthy fats, anti-inflammatory fats that are helpful for hormone production. Exercise improves circulation, energy. I think most women, we feel alive. We feel good about ourselves when we're exercising. You just feel like a young person when you move your body around in a way that feels like, oh, I haven't lost it, ladies. You know, you just feel good when you're moving. And then obviously outside of diet and exercise is decreasing stress, or let me say that differently. Managing your stress perception. I'm gonna let you know that the stressors, things like your kids, your finances, your parents, your career, those things are likely not going to change. The stressors are not going to change, but you can change the way you perceive them through meditations or hobbies that help you change the way you look at the world. Because if you can reduce the stress response to your stressors, your libido can stay up.
So please feel free to ask any questions here in our chat. There are a couple of, as we're nearing actually close to the end of our session, there are a couple of questions I'm going to hone in on. And as we mentioned before, we talked about partners. How can partners support us, right? And have these conversations. So now what we're going to do is, so how can women approach their partners, right? And have these conversations? What are some of the things that they can think about on how to make that step by pulling their partner aside and saying, okay, let's sit down?
Yeah. Okay. I'm going to first put this disclaimer that I'm not a therapist, but I think Jocelyn and I would agree that many times we take on some therapy-like subject matter. And some of the things that I've learned is timing of a communication is super important. It's important to understand that when there are intimacy issues, it's probably a two-sided thing going on, meaning that your partner is likely dealing with some difficulties, challenges, frustrations, concerns, feelings, just like you are, and they may not be the same. So to time opening this possibly difficult conversation at a time where maybe both the individuals are calm, obviously privacy would be an important thing to maintain. And then leading with statements that's more about what you're noticing or feeling versus using statements that say what's happening. Like, you're not taking me out on enough dates, and so I am not loved. You see, that's a blaming statement. Whereas if you say, I've noticed that we're not going out on many dates, and I feel like you don't love me. See, this now shifts it into things are happening, and I'm noticing the objective thing, and from this, I am feeling this. It's not, you're not creating judgment and persecution when you say what you're noticing and feeling. It's opening ways. And then the other thing that you can do, again, is to share specific ways your partner can support you. So it could be that you say something like, I've noticed we're not going out on dates anymore, and I feel like we're losing the charm of how it used to feel when we were dating. I would like for us to, and now offer a solution, go on a date once every week and then give the specifics, like, and I'll ask my mom to babysit the kids. What do you think? So we're solution-based. We're giving, and notice how I say, what do you think? Like, you're allowing conversation and collaboration. And if that kind of discussion is difficult because either you and or your partner, either becomes defensive or avoidant or shuts down, or the other way, like argumentative, and things escalate, then it may be wise to get a third-party couples therapist involved so that they can mediate these necessary conversations, because sexual health could be very important in a relationship. I think, we talk about all different kinds of health, like mental health and physical health and, spiritual health, and sexual health is one of the other pillars that is not a small pillar. It could be just as big, if not bigger, in some relationships.
Mm-hmm. Yeah, it's usually placed in the back burner, you know?
Yeah, it seems like icing on the cake, but I feel like in
Yeah.
some relationships, it is the language that couples communicate love,
Mhm.
especially if it was built on that, then for it to not be there probably is more devastating for the health of the couple. So I don't think there's any age in which we have to say, sexual health, that's just a nice to have. No, if it's important to you, it's a need to have. And then get support, whether it's physical, mental, therapy, to have it optimized and a part of your healthy relationship again.
There's this concept too of the self-care model. And so Dr. Saxena is going to touch about that, about what role that plays in having confidence and in maintaining your confidence in sexual health while you're in menopause and after menopause. Can you tell us a little bit about that?
Yeah, I'd like to just engage the audience a little bit. And would you all be open enough to share anything that you like to do for self-care in the chat? And at minimum, at least you're sharing ideas for other people to consider. But it could also be an exploration of how often we feel comfortable talking about self-care. Because I will say, at least from a cultural perspective, there are women who feel selfish when they take time for themselves to care for themselves. And I think that's a shift that's happening now. I think you remember the concept of the man cave? Like this concept that listen, every now and then a man needs to retreat to his cave to be able to take care of himself. And what that does is allows the man to have quiet time, alone time, reflection time, recalibrate time. And I think women would probably want a similar thing. What do they call it? There's a she shed. I think women may go to a she shed versus a man cave. But the concept is, I think it's important that women dedicate time to take care of their physical bodies. And sometimes in the ritual of taking care of your physical body, whether it's a good massage, a nice long bath, being in comfy sweats while you read a romance novel, if it's, walking in nature, when you're doing something physical, what we'll find is that something mind-body shifts, something with stress shifts. So I don't know about you guys, but a lot of times a physical activity, and what I mean by physical activity means something you're doing with your body. It could just be physical activity of laying flat on a massage table, but it's an activity that then allows the self-care to be initiated, what's happening in your mind. So I love these massage, yoga, artwork. That's one of my own too. Dancing on my own. I love putting on music from when I was young and then just dancing freely. Spending the day in PJs. Oh yeah, Jocelyn, I'm all about that. We call that bum day in my house. And then we watch movies. And nature has a great tuning fork, guys. If you read or research this world of quantum physics, well, let me do a little sidebar on this because I think it's super important. When Jocelyn and I speak, there's two worlds of subject, two subjects that we are speaking about, two worlds. The first one is the physical world, the physical matter of you. Your vagina, your prolapsed bladder, these kinds of things, your skin, your hair, your belly fat. These are all physical aspects of you. Then the other world is the energetics world. Now, what does that mean? See, the energy of water changes the way the physical nature of water is, right? Like if the energy is one way, water can be steam, or it can be a liquid, or it can be ice. So in the same way, when you look at your physical body, it is very much connected to your energetic body, if you will. So if the energetic body is not healthy, it's really tough to get your physical body healthy. Okay, so interestingly, nature buzzes, if you will, electrically at a certain frequency, and that serves as a tuning fork actually for your cells and your tissues. So one of the reasons we feel so good when we're out in nature, assuming that there's not a ton of cell towers out there interfering with that frequency, when we are grounding, like literally with bare feet on the earth, or we're in the middle of a beautiful forest, it's tuning the energetic body. And if that's happy, it makes physical things work a lot better. So consider incorporating nature or grounding. And you can also create that energetic thing from meditation, mindfulness into your daily ritual. And the best time to do that is early morning. It's in Eastern philosophy, and you probably have noticed this, like your ability to connect deeply with yourself is easier in the morning before the rush of the day. And then at night, it could be useful, but we tend to have this kind of tendency to want to rest. It's not our contemplation is almost clearest first thing in the morning, and in Eastern philosophy, 2 hours before sunrise. So that time period is why many people would say to meditate then, do your yoga then, do your strategic planning, because you have such clarity at that time.
That's wonderful. Thank you, Dr. Saxena. That's, I was going to mention about the grounding. I was going to ask you about that because I just started doing it.
Yeah.
I think it's important. When we talk about self-care too, when we take care of ourselves, right, we become more confident in ourselves to communicate. There was a question that we posted in an earlier series about how we can improve our communication with our providers. And I find that, a woman that comes to me who's very self-confident and who's comfortable talking about sexual health, it makes me become more of an active listener, and we can then develop a therapeutic relationship, and I know I can address her needs quicker, right? So by taking care of yourself, that will add your confidence that you can communicate effectively with your loved ones, with your partners, with your providers. I think that's all very, very important. I hope that you will learn a lot from the session and take it home with you and have that discussion with your husband, and even maybe have him watch our series today since everything's recorded.
Yeah, that's right. I mean, sometimes it's easier to have somebody else communicate some of the things going on because you may not feel either confident or educated enough to remember how to restate these things. So, and also what's interesting is sometimes the information coming from someone outside of you lands differently for your partner because, there are times where I can send a social media post describing something to my husband or my daughters, and it just is received differently than it would be if I said it myself. So we can use this whole social media thing to our advantage. It doesn't always have to be a deterrent to connection. It could augment connection that way.
Wonderful. So in our next webinar, we're going to discuss health and vitality after menopause. And Dr. Saxena is going to kind of reinforce some information we've already learned, but she's going to bring that in and teach us how we can age gracefully.
Yeah, and we're going to be talking about a real popular topic, which is osteoporosis. A lot of times when we talk about hormones, we're thinking about sexuality and appearance and energy. And hey, by the way, it's super important that we address certain risks like brain aging and bone destruction while we're working on our youthfulness. So I think
finish early. Yeah.
What do you think, Jocelyn? I think we've milked this.
If we've missed anything, please post your question. Like as we reiterated, this is a very safe environment, and we want you to feel comfortable to ask us any questions.
Well, we appreciate your time, and remember that we have that WhatsApp group as well, because you might want to simmer on some of these topics and maybe think about how you'd want to post the question. But we're always here for you, and we're excited to be able to bring up this subject because it's something that's kind of been taboo for many women in our generation, and we want it to be just as comfortable as talking about your nose. It's just a different part of your body that you want to function well. So until we meet again, thank you for your attention and your participation.
Have a great day.
Thank you. Thank you, Jocelyn. Thank you, Dr. Shilpa. It was a wonderful talk because like you rightly said, there is a lot of taboo even about expressing. So you so beautifully together brought out that it's not, menopause is not loss of intimacy, but it is rather an invitation to rediscover confidence that gets lost over a period of time because of different things. Bring up that connection and comfort on your own terms. So thank you so much for very gently sensitizing and helping us think through how we should look at ourselves rather than feeling bad about so many things and feeling about loss of control. So it's not loss of control, it's recognizing and working on your own self. Thank you. Thank you so much.
Thank you.
Mm-hmm. Yes.
Thank you. So with this, can we close today's session or we should wait for some more time?
Well, we've left the chat open for questions, and I think maybe, again, the nature of this subject is probably something that people need to warm up to. So it's okay if nobody has any questions right now for this webinar. We have the WhatsApp group to be able to ask, but hopefully a good webinar will give you information, whether you talk about it in group or not. I hope you've been empowered. So we've got one quick question here. Thank you, Usha. Any recommendations for pelvic floor health exercises? So the one you've probably heard of is Kegels or Kegels. And that's when you are specifically trying to contract the muscles that are between the rectum and the vaginal opening. So some people imagine they're trying to squeeze $100 bill between their butt cheeks. You want to really make sure that you're squeezing the muscles that are between those two openings versus squeezing something else. And if you're not sure, that's where a pelvic floor therapist can use tools, biofeedback tools, to make sure you're doing it correctly, because what we don't want is you squeezing other parts and moving things around in the wrong way. But I think Kegels, it's kind of, Jocelyn, what's the other way? Is it kind of like you teach people, like if you wanted to not release gas, what you may try to squeeze down there?
Yeah, actually what I would explain it to my patients is when you're urinating, hold the urine. So when you are stopping the urine flow, those are the muscles that you're using, those pelvic floor muscles. And so that's one way of, once you're able to isolate that and that sensation and control of stopping the urine flow, then you can keep practicing that. And those are that's Kegels.
And Jocelyn, would you mind, after we're done here, putting a little recommendation on how to do, or like how many Kegels to do in the chat afterwards so that people have it for reference in the main community one? We'll do that for you.
You can never do enough. You could do 1,000 a day if you have the intention and the muscle strength for.
Yeah, so the more the merrier, and then that helps set you up for having great perineal strength. Just like you're trying to train your, quadriceps and your biceps, the perineal muscles are essential for preventing incontinence and also, again, keeping things in the right alignment for sexual health. The other thing to note is just as important as it is to be able to scrunch with a Kegel, it's important to be able to relax, to not have vaginismus, which is the tightening, like the anticipatory, like clench. We don't want that. So you want to be able to do Kegels, but then also learn how to relax that perineal area mindfully. So during intercourse, it's not painful from like contractions that you don't even realize you're doing. So strength training, Usha, we're going to be talking about in a future webinar. because, and we can talk about it probably at the next one, because strength is a big part of aging gracefully. So if we can leave that as a cliffhanger for you, this forces you to have to attend the next one, Usha. All right, Sneha, I think you're welcome, Usha. Thanks for participating. Sneha, I think it's a wrap then, if you have any last announcements for the crew.
Yes. Yeah, we can back up. I just have a personal sharing, if it is okay to share right now.
Of
Kegels
course.
is something that I do personally, and it's one of the most discreet exercise you can do anytime, anywhere. Nobody knows about it.
Mhm.
But it really helps a lot. Of course, it helps with, I have seen it helps with posture, because then you get a little more conscious when you're trying to do something for yourself. So that is one. But also the laxity of the muscle and being able to control them well. Yes, it's helped a lot. Yeah.
Wonderful.
Okay. Thank you. Thank you for hearing us out and also giving us all of this wonderful information. We're looking forward for the next webinar again. And we welcome more and more questions on the WhatsApp group. So we will get answers to all of them. Thank you.
Bye, everyone.
Bye.
Thank you.
Have a wonderful day.